I think the main unmet need in the world of pediatric ophthalmology and strabismus, which is my particular area of interest, is the shortage of ophthalmologists who currently go into this specialty. And the reason being that it's hard work. Dealing with a child and the parents is almost like dealing with two patients. We also know that examining a child takes longer, is more difficult. It is sometimes said in the world of movies or TV, don't deal with children or pets because of the unpredictability. And it's certainly the case that if you're dealing with children, you may have more difficulty carrying out the examination. And that is sometimes seen as a medico-legal danger. And yet, it's twice as rewarding if you're able to examine a child and examine them well and establish a good rapport with the child and the family. So there is a definite need. Sadly, at the present time, not only in the UK and Europe, but worldwide, there is a shortage of people getting into that field. There is also a huge need for pediatric ophthalmologists to look after premature babies. Other specialties like neonatology are making huge progress and keeping more and more babies alive, even from the age of 23 weeks gestation. And those babies are at high risk of eye problems. And if they are not examined on time and treated in a timely fashion, we end up with more blind children, which is very unfortunate. I think I'll refer again to the retinopathy of prematurity because it's one of the areas in pediatric ophthalmology where there are serious and very relevant changes. One of the reasons pediatric ophthalmologists are in demand and at the same time they find it tedious is the immediacy of treatment for ROP that is essential. And the failure to laser properly, or babies who are not well enough to be anesthetized if they require general anesthetic for laser. So the fact that we are now able to use anti-VEGF chemicals injected in the eye is a revolution. But like any change of that kind, it takes time, and we are going through that phase of discovering or fine-tuning what are the best ones to use, what's the correct dosage, and what to expect, because we are effectively changing the natural history of the condition. And whilst there is a lot of work going on, it's not entirely clear yet what we should inject, how often, and really how often should those babies be seen and for how long after what appears to be an initial improvement. Well, it goes without saying as I organize those sessions, but also my special area of interest is in pediatric and strabismus, as already mentioned. But I'm also very much involved with education and training and the European exams. When I was president of the European Board of Ophthalmology a number of years ago, I had in my manifesto this ambition to start subspecialty exams. So I am very interested in sessions related to education, training and teaching across Europe, which I think is essential for the uniformity of treatment and uniformity of training and eventually treatment of patients across Europe. It is also a very good opportunity, and I think this is one of the very strong points of this Congress, is to attend the keynote lectures in areas outside our very small areas of expertise, because there is always the danger that we do end up going to our own little meetings and we become almost too focused on our particular area of interest. And there is always the need to keep ahead and to keep abreast of changes and progress in other areas, because there are areas of common interest and areas of overlap between different parts of ophthalmology. And I think as an ophthalmologist, at least for me personally, I would like to continue to be aware of what's happening in other fields. And it's a very, very good way of catching up with what's happening, the state of the art in other areas of ophthalmology other than my own little patch. Well, I think young ophthalmologists have done an enormous job, and they've got together, and now they have a very good way of linking together, of exchanging information, of finding out what's happening in different parts of Europe. Now they've finished this fact-finding exercise. My advice to them would be to find the right channels to actually make their voice heard, because it's one good thing to talk to each other and find out what's going on in different parts of Europe. But the greatest value at the end of the day is to be able to use this data, those findings, to actually make their voice heard to the politicians, because there are certainly needs to change, for instance, surgical training, improve the length of training in some countries in Europe, and this can only happen if you use the data you have to present it to politicians in a way that convinces them that change is needed. At the same time, I think young ophthalmologists will, I'm sure, be much better than the older generation at embracing change, because the world around us is changing. We know that if we look outside the world of medicine, you realize that, for instance, as I mentioned yesterday in my presentation, Daimler-Benz have said that their main competitors are no longer other car manufacturers. They are the likes of Tesla, Google, Apple, Amazon, and their world is changing. So they will have automated cars. The number of RTA around the world will probably drop by a tenth, from 1.2 million a year. That will impact on car insurance. You won't need a driving license. The world is changing. Engineering, lawyers are affected. The US reckons that in 10 to 15 years they'll need 90% less lawyers, because the advice you get online has a 90% reliability compared to 70% if you speak to a lawyer. Now, we are not exempt. In the world of medicine, these changes will affect us. So we could either say this is the way we do it, and we did it in the past, and carry on, but change will happen. So you're much better off riding that wave and actually shaping the future by accepting that we can no longer say this is the way it was done, so we have to carry on. We have to shape the way education is delivered, the exams are carried out, and obviously eventually the way the medical services are delivered to the patients.